Hello, I am Dr. Jocelyn, a urologist, and today I want to talk to you with as much clarity and closeness as possible about a topic that many men over 60 live with in silence, a topic that sometimes causes shame, fear, and is rarely shared even with the closest partner. Today I want to ask you a direct question. How would you feel if you reached climax with all the intensity of orgasm, but did not see a drop of semen come out? Perhaps this has happened to you once and left you thoughtful, confused, even scared. Maybe it happens to you frequently and you have decided to keep it quiet, holding it as a secret you do not dare to share. Whatever your case may be, I want you to know something fundamental. I understand you deeply. I have seen in my practice men who come in with a restless gaze, not knowing how to explain it. Some barely whisper it, as if confessing a shameful secret that defines them as less of a man. Others tell me that they have even avoided intimacy for fear that their partner will notice, for fear of the question that might come afterward, or simply because they feel that something essential has broken inside them. I have heard patients tell me, "Doctor, I no longer feel complete. I feel like my body has betrayed me," or "I am afraid my wife thinks I no longer desire her." That emotional burden is as real, as heavy, as the physical changes themselves. And that is why today I want to invite you to lift the veil on the taboo. Because what happens in intimacy is not something minor. It is not an irrelevant detail. It is part of your overall health, your confidence, your emotional well-being, and your quality of life. And I'll give you an important heads up. It doesn't mean you've lost your virility or that your masculinity is at risk. What you are experiencing is a signal from your body, a message that needs to be understood and in most cases can be treated. But stay with me, because in the next few minutes, we are going to explore together the causes, the warning signs, and above all, the solutions that science offers us today. Understanding normal ejaculation. Before understanding what happens when semen does not appear, it's worth remembering how a normal ejaculation works. Imagine that inside your body, there is a small orchestra perfectly coordinated. Each instrument plays an essential role, and all must sound at the same time for the melody to be complete. Under normal conditions, the testicles produce sperm. The seminal vesicles provide most of the fluid, rich in nutrients and energy. The prostate, for its part, adds a special fluid that protects and helps transport the sperm. All of this comes together in the urethra, like musicians waiting behind the curtain. When maximum excitement arrives, the muscles of the reproductive system come into action. They contract rhythmically and powerfully, pushing the semen outward. It is a quick, almost automatic process, but the result of exquisite coordination between nerves and muscles. Here appears something key. Orgasm and ejaculation, although they usually occur together, are not exactly the same. Orgasm is the neurological response of pleasure and release. Ejaculation is the physical act of expelling semen. Most men experience them as a single event, but in reality, they are two distinct mechanisms that accompany each other. When both are present, the sensation is complete: pleasure, relaxation, and the visible evidence of semen. And right there is the key to what we will explore today. What happens when that fluid does not appear, even though the sensation is present? What is dry ejaculation? The so-called dry ejaculation is a condition in which the man reaches climax, feels the characteristic pleasure of orgasm, but does not see semen coming out, or notices it in a minimal, almost symbolic amount. At first glance, it seems that the body has completed the entire process because the intensity of pleasure remains. However, something is missing that has always been considered inseparable: seminal fluid. And that absence, no matter how small it may seem, can generate an avalanche of emotions. This difference, although it may sound small in medical terms, is what generates the greatest confusion in human terms. Many men tell me in consultation, "Doctor, I felt the same as always, but it was as if the orgasm was empty." That perception of emptiness is what fuels concern, and in some cases, deep shame about discussing the topic. I have had patients who confessed to me that they checked several times, thinking that maybe they hadn't seen correctly. Others who searched online and filled themselves with fears after reading confusing or alarmist information. And some more who simply decided not to try again, convinced that their sex life had come to an end. It is essential to understand that orgasm is a neurological phenomenon, governed by the brain and the nerves that transmit the signal of pleasure. Ejaculation, on the other hand, is a mechanical, muscular, and glandular act. The the ducts contract, the valves open, and the semen is expelled. They generally occur together, synchronized with millimeter precision, but they are not the same. When the first happens without the second, that confusing perplexity arises. Is my virility failing? Have I lost my masculinity? Am I no longer the man I was? And here I want to be absolutely clear. The answer is no, absolutely not. Dry ejaculation does not mean that desire or the ability to feel pleasure has extinguished. It simply means that the body has changed a part of its usual functioning, but its essence as a man, its ability to feel, to connect, to enjoy, remains intact. This phenomenon has various causes, some temporary and others permanent. It may be related to medical interventions, medications, hormonal changes, or even diseases that affect the nervous system or the prostate. The important thing is to understand that behind each case there is an explanation, and many times also a solution. Main causes. Cause 1. Retrograde ejaculation. Among all the causes that explain dry ejaculation, one of the most common is retrograde ejaculation. And I must say that it is also one of the most confusing when I explain it for the first time. To understand it, imagine a gate that should close firmly at the neck of the bladder during orgasm. When it works well, that gate blocks the passage to the bladder and directs the semen outward. But if that gate remains open, the semen takes the easier path. It goes back into the bladder instead of exiting through the penis. The result is simple to describe. The man feels the orgasm with all its intensity, muscle contractions occur, pleasure is present, but he does not see semen. It's as if the whole mechanism works, except for the final direction of the fluid. Many times you discover what is happening when you notice that your urine is cloudier after intercourse, because seminal fluid has mixed in. Some patients have told me, "Doctor, I thought something was wrong with my kidneys," or "I thought I had a severe urinary infection." The causes are varied. One of the most common is surgeries on the prostate or bladder, such as transurethral resection or laser interventions. These procedures save lives, relieve bothersome symptoms, and dramatically improve urinary quality. But sometimes, as an inevitable side effect, they alter the coordination of the nerves and muscles of the bladder neck. Also, certain medications for hypertension, some antidepressants, and drugs used in benign prostatic hyperplasia inadvertently relax that area, allowing semen to flow backward. This is an effect that is often not mentioned at the beginning of treatment, and when it occurs, it catches the patient by surprise. Neurological damage also plays an important role. Poorly controlled diabetes, which gradually damages the peripheral nerves, multiple sclerosis that attacks the central nervous system, or spinal cord injuries from accidents or trauma interrupt the signals that should close the bladder gate. I clearly remember the case of Jorge, a 58-year-old patient who, after a laser prostate surgery to treat a severe obstruction, came to my office distressed. He said to me, "Doctor, my orgasms are empty. I feel everything like before, but I see nothing. Have I lost my manhood?" When I explained to him that it was a retrograde ejaculation, irreversible in his case due to the type of surgery, but that it did not affect his potency or desire, he breathed a sigh of relief. I showed him the post-ejaculation urine analysis where sperm was clearly present. Then he understood that his virility remained intact, that his body was still functioning, only that the path of the semen had changed direction. The diagnosis is relatively simple. Just a urine analysis performed right after climax is needed to detect sperm in the sample. As for fertility, it is true that retrograde ejaculation prevents natural conception. However, there are assisted reproduction techniques that allow for the recovery of sperm from urine or directly from the testicles. And for men who are not seeking children, intimate life remains pleasurable and complete. The lesson is clear. Retrograde ejaculation does not mean a loss of masculinity. It is a physiological change that deserves diagnosis, understanding, and, in some cases, adaptation of treatments. Cause 2. Obstruction of seminal vesicles. Another important cause of dry ejaculation, less known than retrograde but equally relevant, is the obstruction of the seminal vesicles. These glands, located just behind the bladder, produce between 60 and 70% of the total volume of semen. Their secretion contains fructose and other nutrients that nourish sperm and provide them with energy to fulfill their reproductive function. When the seminal vesicles are blocked, partially or completely, the semen drastically decreases or even disappears, although orgasm is preserved. It is as if the highway through which the fluid should flow is closed. Pleasure is present, but the path of the semen is interrupted. The causes of this obstruction are varied. One of the most common is old infections, such as prostatitis or urinary infections that were not treated properly and left internal scars. Another frequent reason is seminal calculi, small stones similar to kidney stones that block the ejaculatory ducts. There are also congenital cysts in the region of the vesicles or in the vas deferens that remain silent for years and manifest in adulthood. Additionally, pelvic trauma or previous surgeries can narrow the passage of semen. Symptoms guide the diagnosis. Some men feel the orgasm as incomplete or experience deep pelvic pain or persistent discomfort in the groin. Others notice that the semen appears thicker, reduced in volume, or with small clumps. Occasionally, the only sign is infertility with no apparent cause, a common reason for consultation. I remember Fernando, a 34-year-old patient who came with his wife after 3 years of trying to conceive unsuccessfully. He had normal erections and a good sex drive, but he noticed that his semen was becoming increasingly scarce. A transrectal ultrasound revealed a cyst in one of his seminal vesicles. With endoscopic surgery, we were able to remove it, and months later, his wife became pregnant. The diagnosis requires specialized tests: transrectal ultrasound to see the shape and size of the vesicles, a spermogram showing low volume or absence of fructose, and in complex cases, pelvic magnetic resonance imaging. Treatments vary depending on the cause: antibiotics and anti-inflammatories if the origin is infectious, endoscopic surgery to remove stones or open blocked ducts, or ultrasound-guided aspiration in the case of large cysts. Recovery is usually quick and with very good results. In conclusion, obstruction of the seminal vesicles is a silent but treatable cause of dry ejaculation. Identifying it in time allows for the recovery of both sexual function and fertility. Cause 3. Hormonal factors. The third major cause of dry ejaculation is related to hormonal balance, especially testosterone levels. This hormone, produced mainly in the testicles, is the engine that regulates both sperm production and the functioning of the prostate and seminal vesicles. Additionally, it stimulates sexual desire, enhances sensitivity during intimate acts, and is involved in the contraction of the muscles responsible for ejaculation. When testosterone levels drop significantly, the system begins to fail. Initially, a man may notice that the volume of semen is lower or that it becomes clearer and more watery. Over time, other signs appear: decreased libido, less firm erections, less intense and even dry orgasms. Generally, chronic fatigue, loss of muscle mass, and mood changes are also present. It is important to remember that aging in itself should not equate to a total loss of vitality. What happens in many cases is hypogonadism, which is a hormonal deficiency that requires medical attention. This can be primary, when the testicles do not respond adequately, or secondary, when the problem lies in the brain, in the pituitary gland, or in the hypothalamus, which do not send the correct signals. The diagnosis is based on a comprehensive hormonal analysis that includes total and free testosterone, as well as LH, FSH, prolactin, and thyroid hormones. A low testosterone level, especially when accompanied by symptoms, is indicative of a disorder that needs to be treated. The treatment depends on the cause. Testosterone replacement therapy can be administered via injections, gels, or patches, improving energy, libido, and semen production. However, it is not the best option if the man wishes to have children, as it may reduce fertility. In those cases, there are alternative medications that stimulate the natural production of testosterone and sperm. Ultimately, hormonal decline is not a mere detail of aging, but a signal that should be addressed. Restoring balance can mean regaining energy, desire, and a fulfilling sexual life. 4. Warning signs and associated serious illnesses. So far, we have seen causes that, although concerning, often have solutions. However, dry ejaculation can also be a warning of something more serious, a symptom that should not be overlooked when it appears alongside other signs. First, let's consider urological cancers. Prostate cancer, as it grows, can obstruct the ejaculatory ducts, resulting in orgasms without semen or with blood. In more advanced stages, it causes pain during ejaculation and increasingly intense urinary symptoms. Bladder cancer, for its part, alters the release of semen when it invades the bladder neck or urethra and is often accompanied by hematuria. Testicular tumors can also manifest as infertility and absence of seminal fluid. The other category is neurological diseases. Poorly controlled diabetes is the most common cause of nerve damage in the reproductive system. Multiple sclerosis, Parkinson's disease, spinal cord injuries, or strokes also interrupt the signal between the brain and the sexual organs, causing dry or incomplete orgasms. Additionally, there are less common but equally relevant autoimmune and systemic diseases. Lupus can inflame the vessels that nourish the prostate and seminal vesicles. Scleroderma hardens internal tissues, blocking ducts. And sarcoidosis can form granulomas that disrupt seminal flow. When to see a urologist immediately. If dry ejaculation appears suddenly, if it is accompanied by pain, blood in the urine or semen, loss of genital sensitivity, weakness in the legs, or persistent fever, all of these are warning signs indicating a serious problem that cannot wait. In conclusion, although dry ejaculation is often benign, there are situations in which it becomes a crucial warning. Listening to your body and consulting in a timely manner can make a difference, not only for your intimate life but also for your overall health. Number 5, emotional consequences and quality of life. Beyond the physical aspects, dry ejaculation has a profound impact on the emotional life and self-esteem of older men. And I want to pause especially on this point because in my clinical experience, the emotional damage can be as devastating as any physical symptom. Many feel that they have lost some of their masculinity, or that their sexual performance is no longer the same, which generates anxiety, frustration, and, in some cases, complete avoidance of intimacy. It is common to hear stories of men who distance themselves from their partners, who avoid moments of closeness for fear of being judged or because they do not feel whole. Some stop initiating intimate encounters. Others find excuses: tiredness, work stress, minor health issues. But behind those excuses is the deep fear that their partner will discover what they perceive as a failure. Emotional burden can be as heavy as the physical symptoms themselves. I have seen men cry in my office when talking about this. I have heard stories of couples who have become emotionally distant because the man did not dare to explain what he was experiencing. Shame and guilt reinforce a negative cycle, affecting trust, self-esteem, and quality of life in all aspects, not just sexual ones. I remember a patient who told me, "Doctor, my wife thinks I no longer desire her, but that's not it. I desire her as much as always, but I am terrified that she will see that my body no longer responds as it used to." It took him months to gather the courage to come to the appointment, and several more to talk to his wife. When he finally did, she confessed that she thought there was another woman, or that he no longer found her attractive. The conversation he had avoided for so long turned out to be the beginning of his emotional healing. However, it is important to understand that not everything is lost. The absence of semen does not mean a loss of desire, pleasure, or the ability to enjoy intimate contact. Many men maintain normal erections, intense orgasms, and a satisfying sex life. The orgasm remains pleasurable, the emotional connection can deepen, and intimacy can be as rewarding as ever. The first step is to recognize that this is a physiological change, not a personal failure or a punishment of aging. It is not a moral sentence or a loss of virility. It is simply an adaptation of the body, like so many others that occur with the passage of years. Understanding the cause and seeking medical help allows for the recovery of tranquility, self-confidence, and emotional connection with the partner. And here I want to emphasize something crucial. Involving the partner in the process is not optional, it is essential. Open, honest, and vulnerable communication can transform a situation of isolation into an opportunity for greater intimacy. Many couples have told me that after overcoming the initial barrier of fear and shame, their relationship strengthened because they learned to talk about topics they previously considered untouchable. Accepting and addressing the situation openly is key. It not only improves sexual health, but also self-esteem, confidence, and overall quality of life. And remember, asking for help is not a sign of weakness. It is a sign of intelligence and respect for oneself and for the person who shares your life. Number 6, practical tips from Dr. Jocelyn. Living with dry ejaculation can be challenging, but there are practical strategies that help manage the condition and maintain confidence in intimacy. First, never ignore sudden changes in your body. A sudden onset of dry ejaculation or any associated symptoms like pain, blood, or decreased desire requires immediate consultation with a urologist. Your body is sending you a signal, and listening to it in time can make the difference between a minor issue and a serious complication. Second, managing chronic diseases like diabetes and hypertension is essential, as they directly influence sexual function and the nerve coordination necessary for ejaculation. Keep your blood sugar levels in optimal ranges, take your medications consistently, and attend your regular medical checkups. Third, maintaining a healthy lifestyle helps prevent complications. Regular exercise, at least 30 minutes a day, strengthens the cardiovascular system and improves circulation. A balanced diet provides the necessary nutrients for hormonal production. And adequate sleep, between 7 and 8 hours, allows the body to regulate its systems. Fourth, breaking the silence is key. Talking with your partner and a specialist not only clarifies doubts, but also reduces anxiety and improves intimacy. Understanding that dry ejaculation is a physiological change, not a personal failure, helps regain emotional calm. Practice the conversation first if necessary, but talk. Fifth, consider sexual or couples therapy if you feel that the emotional impact is overwhelming. There is no shame in seeking professional support. A specialized therapist can help you process your emotions and improve communication with your partner. Finally, following medical advice and attending regular checkups allows for treatment adjustments, improves sexual function, and, when necessary, explores assisted fertility techniques. There are solutions for almost all causes of dry ejaculation, but they can only be applied if you take the first step. The combination of early diagnosis, healthy habits, open communication, and medical follow-up constitutes the best strategy for maintaining a satisfying intimate life. Your sexual well-being deserves attention and respect. Conclusion. In summary, dry ejaculation is not a sentence of loss of masculinity, nor the end of sexual life. It is simply a signal from the body that deserves attention, understanding, and in many cases, effective treatment. Understanding their causes, whether surgical, hormonal, obstructive, or neurological, is the first step to regaining peace of mind and confidence. Knowledge dispels fear, and appropriate medical action restores well-being. I have seen men who, after receiving a clear diagnosis and proper medical guidance, regain self-confidence and enjoy intimacy without fear or shame. Cases like those of Jorge, Fernando, or Cayetano show that, although the path may require adjustments or interventions, vitality and pleasure remain possible. Sexual life does not end at 60, nor at 70, nor after. Listening to the body, attending regular checkups, and maintaining healthy habits, exercise, balanced nutrition, restorative sleep, and managing chronic diseases reinforces not only sexual function, but also overall health and self-esteem. Do not let silence or resignation control your intimate life. Speaking up, getting informed, and taking timely action can completely transform the experience, restoring confidence, well-being, and emotional connection with your partner. Dry ejaculation is a change, but it is not the end. It is an opportunity to better understand your body, strengthen your relationship, and demonstrate that true masculinity lies in the ability to face challenges with courage and maintain intimacy with love. If you have found this information helpful, share your experience with other men who may be going through the same thing. And remember, consulting a specialist always opens the door to solutions and hope. Your masculinity is not defined by a single bodily function, and your intimate life can remain full and satisfying even in the face of dry ejaculation. I wish you health, confidence, and fulfillment. You are never alone in this process.